Good morning, everyone. In this presentation, I will talk about the monitoring of antimicrobial use in livestock in Sierra Leone, the challenges, the actions, and the impact. How it all started in Sierra Leone. It was in 2019 when Dr. Aruni Zakaria and the TDR team visited Sierra Leone to discuss about a 3-year project on tackling antimicrobial using the SORTIT model. On this picture, you can see the Chief Medical Officer of the Ministry of Health in black, and myself and the Director of Health Security and Emergency. In fact, it was that day that the animal health from the Ministry of Agriculture was considered in operational research for my own country. So I am one of the 3 veterinarians for Sierra Leone, working for the Ministry of Agriculture and Food Security. So on that meeting, we adopted the use of SORTIT, which stands for Structured Operational Research and Training Initiative, with a purpose of generating and utilizing data for informing decision makers. It is a unique program because it targets healthcare workers at all levels who are decision makers like myself, and also government institutions, disease control program, and non-governmental organizations. It was through SORTIT I did my first study. As you may know, antimicrobial are used for preventing and treatment of diseases. Overuse of antimicrobial led to antimicrobial resistance. Regular reporting and monitoring of antimicrobial use is necessary for evaluating prescribing practices and informing antimicrobial stewardship. Since 2012, the Ministry of Agriculture and Food Security, the Livestock and Veterinary Services Division where I'm working, was implementing a framework of reporting. As you can see the organogram, information are coming from chiefdom, which are association of group of villages. On weekly basis, we have what we call community animal health workers that send report to district level, and then at the end of the day, the district will collate and send to national on monthly basis. However, this framework has never been assessed. So it was on that line, we did our own study with an objective of, at country level, to assess first the reporting frequency of antimicrobial use in livestock, the data quality in terms of completeness and concordance, and the availability of human resource and infrastructure at reporting sites, which is district for Sierra Leone. So it was a cross-sectional study done in 14 district livestock offices from 2016 to 2021, where data from district and sub-district were looked at, were reviewed, and also the human infrastructure, human resource, and IT infrastructure also were looked at. So these are my findings. You can see the table divided into 2. On my left-hand side, you see the parameters and the gap. So in terms of data reporting, we had 14 districts in Sierra Leone. Only 3 out of these 14 districts were sending reports on AMR. In terms of completeness, we have only 1% of these reports that were complete out of the 3 that were sending. In terms of human resource, where we have our community animal health workers at chiefdom or district level, 72 out of 168 were sending reports, which represent the 57% gap. And in terms of infrastructure and transport, no computer or internet connectivity were available at this district, and no motorbike for field supervision. So we'll see how difficult the reports was from the chiefdom to national. So how did we communicate these findings? We published the study in an international journal, and we effectively and persuasively communicated the findings to decision makers, both local and international, as you can see on the picture, We have people from WHO country office and Ministry of Health and Agriculture. So the actions. So just after this finding publication to our partners and the ministry, so luckily the Chief Veterinary Officer was there and the Director General of Agriculture. So the minister, through our Director of Livestock and Veterinary Services Division, instituted a countrywide mandatory weekly reports. So instead of monthly, they started sending reports on weekly basis. And we conducted training on data collection in all the districts with our staff. Again, 32 computers and tablets were provided to these staff to start sending reports. 30 motorbikes also were provided to them for field supervision. And we established the district reporting hub where all the reports can be sent. So the impacts at country level. A year later, a colleague of mine did an assessment of my study. These are the findings of our study. So you can see on the parameter column, the before and after. So on the parameter, you are seeing the number of districts. My own study was 3 out of 14. So after our own study, we are seeing now all the districts that report. So we have 100% of district reporting. In terms of completeness, it was just 1%, but now we are at 88%. We are still pushing for us to be at least at 100% in terms of completing, but for now, from 1 to 88, we have made tremendous progress. In terms of infrastructure, no computer were available, neither internet connectivity, but now we have computer and internet connectivity in all our districts offices. In terms of transportation, we have now 32 motorbikes that the field staff are using for supervision, and this supervision is ongoing. So for the wider impact, the research has impacted and strengthening the health system against antimicrobial resistance in Sierra Leone, because initially the Ministry of Agriculture was left out when they are doing any research or operational research, but for now, we are involved. That was done through the support of the TDR sorties in our country. So the research capacity built, by embracing the One Health approach, the comprehensive engagement was established with AMR Coordinating Committee, and the sorted activity are aligned with our own national AMR action plan, which is great. So you can see the picture, the one upside is we invited our local farmers and those who are using these antibiotic or antimicrobials in Sierra Leone. And then down we have partner meeting where we have the Food and Agriculture Organization, the WHO, and Ministry of Health and Agriculture. So personally, I benefited from SOTIT because I learned the practical skill of conducting operational research, developed the skill to mentor others and build critical mass of researchers, and publish policies in relevant paper. And then we are continuing to improve the surveillance of antimicrobial use in our country. At regional level, I am now part of the Regional SOTIT Research Network. At national level, I am part of the National SOTIT Research Network as well. So in terms of capacity building, we have 17 papers that were published. These are some of the examples of them. In terms of sustainability and national embedding, we are now trying to integrate SOTIT in our medical and public health curricula, where they can teach people how to do operational research for AMR. And many of SOTIT alumni are now lecturers in our universities. If we want to know more about the published papers, we can find them in these two special issues. The operational research and capacity building to tackle antimicrobial resistance in Sierra Leone, and the AMR in low and middle income countries. So this special issue have all our publication from Sierra Leone, the 17 papers that were published. We still have some that are undergoing the sorted. By September, they will be closing their program and maybe publishing. This was my own study, my email address for any comment or maybe contribution. So I would like to end this presentation by thanking all of you here supporting the TDR sorted program. For us in the animal sector, because initially everything was human, but thank God now the animal is on board. Yeah, through the support of TDR sorted. Thank you so much.